So let's talk about cleaning orthodontic braces. So with fixed braces, you tend to have this little button or a little bracket, as we call it, bonded to the tooth. And then you have wires that run through that bracket. And there may be other attachments in there that you add on, little elastics and little chains that pull the teeth into position. It's difficult enough to clean your normal teeth with all their nooks and crannies, never mind all the added nooks and crannies you get with orthodontic braces. I always advise Oral-B electric toothbrushes. I just love the fact that we get such great results with them. And with these Oral-B brushes, there is an Orthocare Essentials pack of heads which you can get for the brush. Your little in-between clean head, which I advise generally for a lot of people to use in between their teeth. And the other is a little Orthocare head. It has bristles which will clean inside that bracket, inside that wee button, and it will wrap around the outside of the bracket. If your electric toothbrush, so it's not doing a full 360 turn, so it's not going to harm the bracket in any way. It's going to clean around the bracket. Oscillate and rotate in action is what the brush is doing. It's this kind of action. With Oral-B brushes, you're always wanting to hold the brush, you're not wanting to brush with it. So it's a push, not brush technique. So the same thing goes with these orthodontic braces. You're wanting to push, not brush. You're wanting to let the brush head wrap round the bracket, and the little bristles that are in between is going to clean that space in between the bracket. So you're just holding it on the tooth for about 1, 2, 3, next tooth 1, 2, 3, really let it sit in the bracket. And then you'll change to your in-between clean head, and you can go in between the little brackets, in between the grooves, and just clean in there. The easiest way to keep on top of the braces. The other thing to minimise the amount of plaque bacteria that's been left behind in the mouth is always to clean the tongue. Free up any bacteria that's on there. You're going to freshen up breath, enhance taste, get a bit of tongue cleaning done in there. Listerine comes in a Listerine Junior and it comes in Listerine Zero. For orthodontic braces, I would always be saying use a bit of Listerine. I have a different video about Listerine and the reasons why I advise it, but yeah, I do advise Listerine mouthwash. 2 other items for orthodontic cleaning. The orthodontic braces can harbour more bacteria. They can harbour a little bit more acid from an acid attack when there's sugars in the diet that acts with the plaque bacteria. And one of the things that we see is if the cleaning hasn't been done perfectly, the teeth are lovely and straight, the braces come off, but we have white decalcification marks around the teeth where plaque has been sitting around the tooth, and there's been a little acid attack, and it's been decalcifying, stripping the minerals from the tooth. And the very first stages of tooth decay is decalcification, these white spots that appear on the tooth because of loss of minerals. Biomin F toothpaste. In your normal toothpaste, you might have 1250 up to about 1450 parts per million fluoride in them. And in your normal toothpaste, you will maybe get protection for about 90, up to about 90 minutes after you brush. You'll get a bit of protection from that toothpaste. Biomin locks into the tooth surface. It's 500 parts per million fluoride, so it's a lower fluoride, but it is coming out like a shield force onto the surface of the tooth for up to between 8 to 12 hours after you've brushed with it. So you're going to get between 8 and 12 hours protection. And when there are areas in there that are harbouring a bit of bacteria that are likely maybe to decalcify, then having that extra protection is just a bit of a game changer for me. So I always advise all my orthodontic patients to go on to Biomin toothpaste. Biomin F is also really useful for sensitivity, and not only for orthodontics, but because it comes out like a shield force every time the pH level in the mouth drops, every time you're going into acid attack, acid erosion, gastric reflux, pregnancy, sickness, morning sickness, eating disorders where you're being sick a lot, this toothpaste can really help to save the teeth. It can really help to bring out that extra shield force of protection for up to 12 hours a day. So it is a bit of a game changer for me. And then we have Dr. Hef's Remarkable Mints. Every time you have something to eat or drink, you have an acid attack in your mouth, unless you're just drinking water. But most of what we eat and drink, you're going to have an acid attack in your mouth. And when we eat something that has sugar in it, the sugar acts with plaque bacteria on the tooth surface and creates an acid, and that acid strips the minerals from your teeth. Now, as soon as you start eating or drinking something that is causing that acidity, until the point where you finish eating and drinking, and then plus 20 to 30 minutes for your saliva to neutralise the acid attack in the mouth and put you back into safe zone, is how long you're in that danger sort of level in the mouth. Dr. Hef's Remarkable Mints are xylitol, so there is a slight laxative effect if you were to have too many of these. They are dental mints, they are not just random mints that you would take a handful of. You would have one after eating, and it immediately neutralises the acid attack in the mouth, returning you to safe zone without waiting for that 20 to 30 minutes buffer time. And because they are xylitol, it inhibits plaque growth as well. So they're quite good as a wee sort of double whammy, inhibiting the growth of plaque and neutralising the acid attack. So they're great for after food when you have a brace on. These would also be quite useful for retainers as well, when you're in the full-time retainer wearing stage, or when you're doing Invisalign treatments where you're wearing that appliance, your sort of aligners for 22 out of 24 hours a day. You're only meant to take them out to eat, and then you're meant to clean and put them back in again. So a wee Dr. Hef's mint is going to neutralise any acid attack if you have been snacking in between times, and just keep the teeth a bit safer. This piece of advice for orthodontic wearers is come in for a no-flow hygiene. Let me help you take care of your brace, let me tailor products to you, and let me help you keep everything really nice and clean and healthy.